Regarding my evaluation plan worksheet for the discharge checklist implementation, I will focus on varying questions that will help lead to a better idea of how effective the planning has been. First, I would address questions that relate to the planning and implementation issues, such as what material was distributed, if nurses were instructed that it was evidence-based practice by implementing an discharge checklist, as well as using an assessing tool, which will help create finalized version of the discharge checklist, to also figure out if staff were trained on the use of the checklist and the appropriate process, as well as if any trainings were provided. I would also focus on how perceptive nurses were during the initiation of the discharge checklist, as well as during the plan to implement the discharge checklist. I would evaluate the program's impact on participants, so I would evaluate on the nurses' receptibility, as well as the patients and the staff's involvement on the implementation of the checklist. How to know if the checklist has been effective, I would use indicators. The indicators would focus on the nurse's involvement, on a nurse expressing their understanding of the feasibility and accessibility of the program, as well as evaluating the checklist, if staff understands the importance and the use, what percentage of staff actually uses it, and what the readmission rates are on the percentage of staff that use the discharge checklist. I would also want to evaluate which nurses were consistent and involved with the implementation of the discharge checklist. So I would want to evaluate the data on a quarterly basis. I would also take into consideration the higher acuity, high census times, as well as the different seasons. So I felt like the quarterly basis would be best to be able to figure out if anything should be altered and changing things as time progresses if needed. I would collect data using discharge liaisons, management, and supervisor input, and also notifying them of who will have the information of the discharge checklist. I would utilize current databases. I would have records of admissions and readmissions as well as discharges and the processes at the time. I would utilize surveys. I would also utilize surveys on what patients were provided with the discharge checklist, as well as what nurses actually participated in the in-services and implemented the discharge checklist. I would sample patients, nurses, and discharge planners regarding the questions. And the tools I would use are surveys via telephone, mail surveys, or on-site surveys for nurses or even patients prior to discharge. I would interview patients and nurses, and I would use the HCAHPS regarding the quality of care patients believe they have received. And regarding the readmission rates, I would focus on the Agency for Healthcare and Quality Research to see if those indicators have shown that they have improved.